The next item on our agenda is House File 337 from Representative Zelisticard. Representative Zelisticard, would you like to move and reinforce, would you like to, no, it would be not. What's that? Would you like to move the bill before the committee?
Thank you, Chair Backer. Yes.
Representative Zelisticard, I believe you have an A2 author amendment. Would you like to move your amendment?
Thank you, Chair Backer. And members, I'd like to offer the A2 amendment and move to divide the amendment after line 1.19 and adopt lines 1.2 to 1.19.
Okay, the author would like to make that motion. All those in favor say aye. Aye. All those opposed say nay. The motion prevails and lines 1.2 to 1.19 of the A2 are adopted. Representative Zelisticard, to your bill as amended.
Thank you, Chair Backer. And members, this bill is a continued discussion on rural EMS, Greater Minnesota, and the partnership that took place with Chair Backer and Representative Hewitt and myself in the House, and then we had Senate bipartisan support too, as was noted. And so we continue to try to find solutions. And I appreciate the director's presentation first as we look at that 24 million and then the sprint model. As we go forward, we are clear that Greater Minnesota is having an operating deficit. And so what this bill does is it's going to allow us to propose a new coding method and a new pathway to look at facilities that have an operating deficit. There would be a system in place to identify them where they would have their financials audited. And then the larger areas, the 7-county metro, Duluth, Mankato, Rochester, St. Cloud, would be ineligible for grants when we develop this, as it continues to become shaped on what the best pathway forward. So, you know, we're going to continue to work on this, and just wanted to present to you that we have not arrived, to Representative Hewitt's point, on solving all the issues and solutions. We know we have to not do a Band-Aid, but have something that's lasting and that's long-term, and that is going to be reasonable and make sense. And so today, this is just letting you be aware, members, that we are looking at having some type of a grant program that would identify that as we move forward.
Okay, so we're going then, thank you, Representative. We're going to turn it over to testifiers. Each testifier we have right now 5 for House File 337. First on deck is Eric Simonson. After Eric is Mike Warner, and then Tim Myers after that. So 2 minutes. Yes, even to an ex-senator, or I should say senator, only gets 2 minutes.
Thank you, Mr. Chair and members of the committee. My name is Eric Simonson, and I represent the Coalition of Greater Minnesota Cities. That's an organization of about 115 cities, all outside the 7-county metro area. House File 337, as amended, picks up where last session's one-time aid bill left off. We said we wanted to come back this session with a longer-term solution, and we want to thank Representative Lesnikar, Chair Backer, Representative Hewitt, and so many others around this committee that helped us get to this point over the interim. House File 337 addresses several concerns we have heard over the past 2 years of working on this particular challenge. Number one, it addresses the operating deficits so many Greater Minnesota licensed ground ambulance services are facing annually to no fault of their own. 2, it provides a clean formula using data provided to the state that distributes grant dollars only where they are needed. 3, it provides clear guidelines on what the grant dollars can be expended for. And it provides the clarity that the Office of Emergency Medical Services can perform audits of grant applications. It addresses the uncompensated care problem for ambulance services. It addresses the cost of readiness within the operational costs. And it provides reporting back to the legislature in the interest of accountability and transparency. We know, based on the 2023 reporting period, that non-metro services reported deficits totaling more than $30 million when you use the formula within this bill. This bill resolves a challenge over 20 years in the making. As rural Minnesota ages, the payer mix trends even more to Medicare, Medicaid, and we know those reimbursements are trending well below 40%. Mr. Chair, members, by splitting the amendment, we don't have a revenue source yet, and I think that's okay. The bill as amended right now creates a policy and develops a fund within the OEMS that would collect revenues at some future time. We recognize that that conversation needs to continue going forward, and we are happy to be a part of that conversation, Mr. Chair.
Okay, thank you, thank you. Mike Warner, you're next, then Tim Myers, and then Nathaniel Zacharias is after that. 2 minutes, please. Please state your name and your 2-minute testimony. Go ahead, please.
Thank you. Thank you, Mr. Chair, members of the committee. My name is Mike Warner, and I'm the fire chief for the City of Red Wing Fire Department. And I'm here to testify today in support of House File 337 as amended. The City of Red Wing owns and operates around the clock an advanced life support transport ambulance within our PSA, primary service area. We cover approximately 226 square miles, with 46 of that being inside of the city proper, and the remaining in the surrounding township areas and rural areas. In 2024, we responded to 3,818 ambulance calls. Furthermore, 233 of them were in the rural areas. Our payer mix for Red Wing is 72% government funded, with the remaining being private and/or self-pay. The challenge with the government funded is only able to collect about a quarter of the actual cost. Due to our payer mix, there's a general operating shortfall which requires subsidies from the City of Red Wing taxpayers to all other residents or other people who are visiting our area. City is very appreciative of the one-time emergency aid funding that Red Wing received and will be more grateful for the sustainable solution for House File 337. I'd like to thank you, Representative, for authoring this bill. Thank you, Chair and members for the committee and following for this testifying.
Thank you there, Mr. Warner. Tim Myers next, and then on deck is Nathan Zacharias, and then finally Kevin Lee. Go ahead, Tim, please. State your name and your testimony. Go ahead.
My name is Tim Meyer. Good afternoon, Chairman Backer, members of the committee. I'm the Senior Director for Sanford Ambulance. We operate ambulances in Moorhead, Thief River Falls, Bagley, Wheaton, Worthington, Laverne, and Canby. And my organization supports House File 337. The bill provides a structure to support rural EMS in Minnesota for those agencies that cannot generate enough revenue to fully support their operations. There's been a widening gap between revenues and expenses for all ambulance services, and those that have low volumes are particularly at risk. The volunteer staffing model that has been the backbone of rural EMS in our country has been in transition for some time now. Less people can or want to volunteer. These pressures have forced many rural ambulance services to pay their staff. They had to cover their schedule. Adding labor costs has a huge impact to a low-volume EMS agency. Without financial support like this bill provides, the long-term viability of many services is in jeopardy. If an ambulance service fails, the service area that is uncovered becomes a burden of the neighboring ambulance services. That increases their economic pressures and results in a cascading problems from one agency to another. We have to attract more people to join the EMS workforce. That will take increased training opportunities, strong local leadership, and we have to pay people to do this work. The EMS industry needs legislative support. Lives really depend on it. Thank you for considering funding a funding structure to ensure the viability of ambulance coverage in rural Minnesota. And I ask you pass House File 337 to support rural EMS, and I'm happy to answer any questions.
Thank you, Mr. Myers. Next, Nathaniel Zacharias, and then finally Kevin Lee. Please state your name and 2 minutes for your testimony.
Good afternoon, Chair Backer and members of the committee. My name is Nathan Zacharias, and I'm the Technology Policy Analyst for the Association of Minnesota Counties. I'm here today to offer AMC's support for House File 337. We have a strong interest in reliable and quality ambulance services for every community in Minnesota. We know that EMS providers struggle with rising operation costs, staffing shortages, and insufficient reimbursement rates. Counties, community boosters, and other local governments have stepped up to close some funding gaps where they can. However, we do need a long-term sustainable funding model to ensure the continued viability of EMS services across the state. Without adequate funding, we risk losing these critical services, which would have a devastating consequence for communities across the state. And that's why we believe House File 337 is so important. This bill represents funding certainty and a guarantee from the state that Minnesotans can continue to rely on these essential services. And I'll just close by saying thank you to Representative Zalesnikar for carrying this legislation, as well as Chair Backer, Representative Hewitt, and other members of the EMS Task Force and members of this committee for your hard work over the last few sessions that has really helped start these important conversations. Thank you for the opportunity to be here today. Happy to answer any questions.
Okay, thank you. We have, then finally, Kevin Lee. State your name and proceed.
Thank you, Mr. Chairman. My name is Kevin Lee, and I am the EMS Relationship Specialist for North Memorial. North Memorial Health is a nonprofit healthcare system that operates hospitals in Robbinsdale and Maple Grove. We also have several clinics, and we have one of the largest EMS systems in the state of Minnesota. I've been with North for 25 years, and I've spent my entire career in Greater Minnesota. I spent 15 of my years at North as the district chief for our Brainerd region. Our ground ambulance service covers 8,183 square miles across Greater Minnesota. This does not include our metro operation. Over the years, we have observed growing trends of smaller ambulance services, including municipal ambulance services, transitioning their ownership to larger providers like North Memorial. This shift occurs because many smaller services are struggling to sustain operations due to financial and staffing challenges. One of the primary financial challenges we face is stagnant Medicaid and Medicare reimbursement rates, which remain our main sources of income. Additionally, rising staffing costs present a significant burden as we must ensure 24/7 coverage. The days of relying on volunteers or on-call personnel to staff ambulances are behind us. While EMS and subordinate taxing districts may provide solutions in some areas, many communities lack the tax capacity to subsidize their local ambulance services. This model also shifts the financial burden onto cities and counties, further straining local resources. In 2024, the legislature took an important first step by allocating $24 million in ambulance sustainability funding. However, ongoing state funding is essential to maintain ambulance services across Greater Minnesota in the long term. Minnesotans rightfully expect a rapid response during medical emergencies, regardless of their location. Ensuring a strong, sustainable EMS system must remain a priority. Please support House File 337. Thank you for your time, and I can answer any questions, Mr. Chairman.
Thank you. Thank you there, Mr. Lee. Now we open up to questions. I'm looking for us to do anywhere, max 10 minutes of questions here so we can get on to the other bills. First on deck is Representative Purcell. You have the floor.
Yes, thank you, Mr. Chair. So I have a question to the bill author. So I have two communities in my district which straddle counties. So and one of the counties is considered a metro county. So Northfield has part in Dakota County, and New Prague has half in Scott County. So on lines 2.31 and 2.32 of the bill, where it just talks about, calls out specific communities that are not eligible. And then looking at the metropolitan county, this is an issue when we look at particular taxes in metro counties. So I'm just wondering how this would apply, for example, in my district. Thank you, Mr. Chair.
Go ahead, Representative Zalesikar.
Thank you, Chair, and thank you, Representative Purcell. I'm going to defer to one of the testifiers because they have all that data.
Please state your name and
I knew you'd do it.
proceed answering.
Thank you, Mr. Chair and Representative. It's an excellent question. The way the bill is drafted, it's for communities that have their PSA that is mostly outside of the metropolitan area. So if you're straddling that 7-county metro line, if you are mostly outside, the way it's written now, that they would be eligible for grants, assuming they had an operational deficit.
Representative Purcell.
Thank you, Mr. Chair. Do you know, so New Prague is divided directly down Main Street, half in Lesueur County and half in Scott County. Do you know where their PSA would be located, for example, if this were to become a problem? Thank you, Mr. Chair.
Mr. Simonson.
Mr. Chair, Representative, excellent question. I don't know off the top of my head, but it's something that we could definitely take a look at.
Okay. Representative Hewitt.
Thank you, Mr. Chair. And would it be okay if we bring Mike Warner back up, the chief?
Go ahead, Mike. Go ahead, Representative Hewitt.
Mr. Chair, Chief Warner, and to the author, if you can answer it also, over and over again in the task force, we heard the cry by local mayors, city councils, county commissioners, that because of the way our EMS system is organized in Minnesota called primary service areas, they have very little local control. In many cases, our local control, or the PSAs, are owned by private entities, which you heard from 2 of them today. This is a good system, but it probably needs to be enhanced. The reason I brought you back up, Chief, is your city owns your PSA. Local control is really important to your city because if something goes wrong, that mayor is going to hold you, Chief, responsible. Is that right?
Mr. Warner.
Yeah, thank you, Chair. Thank you, Representative. Yes, that is correct. If something goes wrong, our city council and mayor will hold me responsible, yes.
So what I'm, Mr. Chair, sorry, what I'm concerned about in this bill, and I think we all, because some of you around the table here have been city council and have been mayors, is the concern over that local control issue, and this bill does not give that. It does not award the purse strings is how government, or that's how we control, right? Through the purse strings. And this bill does not give it to it. It automatically awards a grant, which, like last year when we had emergency grants going out, I understand that. But as we move into a total funding mechanism for EMS, and it's great because you're a fire person too, which has easily been funded through the years. I don't know what you guys got on them, but anyways, EMS is now coming into a public safety entity, which I think everybody around this table recognizes. And so with that, we want local purse strings. We're hearing way too much about fraud, waste, and abuse, right? And we can't have that happen in this space because we don't have the volumes to do that. So it would make sense that the local control is set at the local city councils, government, and stuff like that. And Representative Zalesikar, I don't see that in the bill. And again, I was really optimistic. What you started with today was that we need to work a little bit more on this. And I think your bill can get there. But we also need, and then my other concern definitely is my colleagues on that have already talked about this. Metro is hurting now too. Yes, we had to go to outstate right away with those grants we had to give, and I was totally supportive of that. But we have a Metro problem. Any of you in this room today could get in an accident on 94 and have a response time issue. I care about everyone in this room. I worked in this space. We need to look at this as a statewide problem. And I get it, outstate is hurting a little bit, but we need to look at this as a global issue. And for that reason, I think we still need to send this bill back and do a little bit more work on it. And I'm looking forward to working with you, Representative, on it.
Thank you, Representative Hewitt. Representative Ryer, go ahead.
Thank you, Mr. Chair. Thank you, Representative. My question is about funding, which I know you took out in the amendment, but currently ambulance services can receive funds through a problematic method called revenue recapture. And so my question is, as you look at replacing with an additional new system, if you would be including rescinding that as part of your legislation? Thank you.
Representative Zalestakar.
Thank you, Chair, and thank you for the question, Representative. We're at the beginning stage of looking at all options. So, you know, the reality is we did a Band-Aid approach for an issue coming out of the pandemic and dealing with the 24 million for the ambulances and then the 6 million for the Sprint model. We've toured the state, the representatives in the room here and with the senators, but the reality is we have not fixed it for a long-term sustainable thing. So we are going to overturn every rock to look at the best approach, to Representative Hewitt's point, the best pathway forward that gives us the best chance for success, for making sure that regardless of where you live, that if you need an ambulance, it's going to be able to get there in a timely manner. And so that's all open for discussion right now as we, you know, move to get this in the right order. But that's, we're going to be looking at everything for sure.
Follow? Okay, good. Okay, any last closing statements, Representative Zalestakar?
Thank you, Chair, and thank you, members. I think we all acknowledge that we have an issue for trying to have a solution that's long-term, that's sustainable. And finding the right pathway forward is going to take some further conversations. And so this is an intro today to the concept of what we want to do as we move forward. And I look forward to working with the EMS members that have been working with me for the last 2 years, and I was working with them and other members too, if you have ideas, so that we can get the best for Greater Minnesota and look at the issues for the entire state, so that whatever we do, it is the best path forward, and I think we can get there. Thank you.
Thank you, Representative Zalestakar. Members, with that, House File 337 is laid over as amended for possible inclusion in the omnibus bill.
All right.